service. Good evening.
These are the Hickory Hound's News and Views.
This is the Hickory Hound's News and Views for the week ending August 17th, 2025. This is for the ones who never felt at home in the world as it's become. The people who walk into a room and immediately sense the gap between appearance and truth. Not because they're fragile, but because they notice what others won't name. They remember what things used to mean. If you've sat through a meeting and thought, "Am I the only one who hears the performance?" You're not wrong. You're early. You didn't trade instinct for approval. The world doesn't reward people who stay awake. It calls them difficult or bitter. I know better. People like that were built for discernment, for signal. Their clarity comes from living close to pain and still choosing to build. That's why I do this work, not to chase headlines, but to tell you you're not alone. The dislocation you feel is not failure, it's conscience. When I write about institutional decay, economic drift, or cultural loss, it isn't superiority, it's duty. Because I know there are still people who care, even when caring is exhausting. It matters, even if you're never celebrated, even if you're pushed aside. What you carry is not a burden, it's a compass. And we need every compass we can find. I don't write for the crowd. I write for those who keep their integrity, who mend what's in front of them, who won't bend truth for ease. If that's you, this belongs to you as much as it belongs to me. There's still time to shape what's to come next, but only if we stop waiting for permission. The world may not understand you. It may never reward you. That doesn't make you wrong. It means you're still awake, and you are not alone.
Good evening. This is Rachel AI reporting for the Hickory Hound. Here's what the Hound covered this week and why it matters. On Monday, on the Hound Signal on Substack, we had the intro and the first chapter, The Collapse, of the Foothills Corridor book. It is a clear account of how Western North Carolina's industrial backbone was dismantled, by design, not fate. Trade policy, corporate consolidation, and political neglect set the terms. Communities paid the price. The frame is simple. Name the causes so recovery is intentional, not cosmetic. On Tuesday, we heard virtual call-ins to Dear Rachel. The title, Carrying the Weight, represent three archetypes, the young returner, the displaced worker, and the normie. Surface a core tension. Love of place versus the cost of trying to save it. The counsel is disciplined. Protect your energy, choose your battles wisely, and remember that awareness isn't obligation. On Thursday on The Hound, we heard about disconnected commutes, the transportation divide. Car dependence and thin transit create transit deserts that isolate seniors, students, and low-wage workers. The call is for integrated mobility, linking housing, jobs, healthcare, and education, because opportunity without access isn't opportunity. On Friday, back to the Signal on Substack and the Foothills Corridor. Chapter 2, Parallel Declines. A side-by-side view with the Rust Belt. Same forces, globalization, automation, policy drift, but different choices ahead. Hickory still has structural advantages. Avoiding repetition means diversification, cultural investment, and unified leadership now, not later. That's the week. Back to the work with this week's feature story. Tonight's feature is a Civic health checkup. The dynamics of a healthy person. Because individual wellness and community design are inseparable. First, the physical environment. Health is built block by block. Where sidewalks end, movement ends. Where lighting is poor, evening activity disappears. Parks, trails, and safe crossings are not amenities. They're baselines. In neighborhoods that lack them, rates of obesity, hypertension, and diabetes spike. Design choices show up in lab results. Second, nutrition and food access. Surrounded by farmland, yet short on affordable, healthy options. This is the paradox. Grocery deserts and thin transit push families toward processed calories. Closing the gap means pragmatic tools, neighborhood markets, mobile produce, farm partnerships. This isn't retail theory, it's health equity. Third, obesity and chronic disease. When a third of adults carry preventable, compounding conditions, it's not a string of private choices, it's a system signal. Sedentary design, time poverty, and fragmented care produce predictable outcomes. If we want different numbers, we need different inputs. Fourth, brain health. Renaming behavioral health as brain health destigmatizes the need for care. But language isn't access. Waitlists, geography, and awareness still block treatment. A healthy community helps people find help fast, before a hard week becomes a hard year. Fifth, demographic pressures and equity. As the county diversifies, disparities persist. If program design ignores how burden concentrates, by income, by neighborhood, results will miss the people who need them most. Equity is not a slogan. It is the discipline of meeting need where it actually lives. Sixth, civic metrics and accountability. External rankings on well-being and economic vitality aren't curses, they're instruments. The job isn't to spin them. It's to study their construction, set public targets, and report honest progress. What we track, we tend to improve. The charge. A healthier Hickory doesn't require a miracle. It requires alignment. Streets that invite movement, food systems that deliver freshness at working family prices, clinics and counselors close to where people live, data that is faced, not massaged. The assets are here. The choice is whether we will use them with clarity and resolve.
In my own time is a mission statement. This platform doesn't exist for flattery. It exists to measure reality, explain causes, and propose correction. Health, economy, and livability are the results of decades of decisions. We treat rankings as baselines, not insults. Streets and food access are health infrastructure. Accountability is the honest route to improvement. The Hickory Hound will keep an unvarnished record of where we stand, why we got here, and how we can change course. This week's focus, the dynamics of a healthy person, is a call to shared responsibility. If we do the work with intention, we can build a community that thrives by design, because it won't happen by accident. In closing, silent streets reveal truth measured in hard numbers. We choose rise or we fall.